In today's video, we are debunking some medication myths that have been out there for a long time. If you've believed any of these myths, you are not alone, and that is exactly why I'm addressing this, so don't feel bad. Myth number one is that over-the-counter medications and supplements are completely safe. There are several over-the-counter medications that can be harmful when not taken appropriately, such as Tylenol. If taken too much, can cause liver damage. If you take the common heartburn medication omeprazole or Prilosec, if taken long-term when it's not appropriate, can actually damage your bone strength. As far as supplements go, common supplements such as ginger, ginkgo, garlic can cause serious medication interactions. Have you ever heard of St. John's wort? It is also a huge offender when it comes to drug interactions. That's why it's important to talk to your doctor or pharmacist before taking these medications. Myth number two is submitted by one of the Instagram followers, so I'll leave the names to any of those down below as they pop up. Myth number two is that I don't need to take my medications for my blood pressure or antibiotics because I feel fine. Please don't do this. When it comes to your blood pressure medications, oftentimes you don't feel the effects of high blood pressure when it's actually high. Additionally, it's more the long-term consequences that we're concerned with, so not taking it now just because you feel fine can lead to you not feeling so fine later down the road. When it comes to antibiotics, we are glad that you're feeling better, but the problem is that doesn't mean all of the bacteria is gone. That's why we continue that course for longer than just till you feel better. Stopping your antibiotics early can actually cause major issues such as antibiotic resistance, so please finish your antibiotics. Myth number three is another antibiotic-related myth. This one states if you have a cold, then you need an antibiotic. No, that's not true. Most of the infections that we have that cause a cold or a respiratory tract infection are actually viral illnesses, and antibiotics don't work at all for those. For the majority of viruses, we don't have anything that will actually work, so getting a pill from your doctor isn't really recommended. If your blood work shows bacteria, it's bacteria and we can treat it with an antibiotic, but just because you have a cold doesn't mean you need a pill at all. Myth number four is that when your doctor or pharmacist asks about medications, that doesn't include supplements or vitamins. This is not true. We need to know everything that you're taking, essential oils included. When you're taking these medications, that could give us key indications to a lot of things. Number one, is there any drug interactions going on that are causing any issues you're having right now? Number two, maybe you have too much of a vitamin or a supplement that you're taking, and that is causing the issues you're having right now. And number three, you may be having a side effect to one of those things that you are taking, and that is why you're having issues right now. That's why it's always important for your doctor or pharmacist to know if you're on these things. We're not here to judge if you're taking a supplement that maybe we don't fully agree with, but we are here to keep you safe, and we can't do that if we don't know everything you're on. Before we hit number five, if you are liking this video, make sure you're giving it a thumbs up and you hit that subscribe button because I have more myths coming your way. And next up is myth number five. This was another one submitted by an Instagram follower stating that essential oils can cure heart disease. No. Essential oils can be a whole nother talk, but heart disease, as of now, has had no proven benefit with essential oils. Even with medication, heart disease is a complicated disease state that requires many medications in order to get it regulated. Essential oils aren't your miracle cure. Essential oils aren't regulated like medications, so you honestly have no idea what you're getting. It could be a smaller amount than what it's saying, it could be a higher amount than what it's saying. There is zero regulation or any accountability to keep it what it's even saying it is. So please, if you have heart disease, stay on your medications. Myth number six is the best place to keep medications is the bathroom. No! I don't know what designer decided that medicine cabinets needed to be in the bathroom, but they obviously never talked to their pharmacist. I did a whole video on your medication cabinet, so make sure you check that out, but basically what you need to know is that cool, dry places are the best place to store your medication, and your bathroom is probably the exact opposite of that, especially when you think about it and you're taking showers in there, the steam, the heat, bad for your meds. I recommend keeping your medications in your kitchen or on your bedside table so you remember them, but you can get the rest of the tips in that video. Tip number seven is that warfarin is rat poison. This was submitted by an Instagram follower, and I have to say this one is pretty much true. Back in the 1920s, several vets noticed that pets, when they would eat this plant called coumarins, would end up with bleeding issues. Over the next 10 to 20 years, dicumarol was taken from those plants concentrated and started to be tested as an anticoagulant. The same ingredient was used in rat poison to thin out their blood and cause them to die. The difference between warfarin that we use today and what we did in rats was it was a lethal dose, a super high dose of warfarin for those rats, versus right now with patients who are on warfarin, they actually get tested, we look at their blood to make sure we're in a right balance. It's always important to remember that anything can be poison, even water. So just because warfarin had been used in rat poison previously doesn't necessarily mean that warfarin is rat poison. Both are just blood thinners. One at a lethal dose and one at a therapeutic dose. Myth number 8 is another myth coming from Instagram stating that you can't take dairy products with fluoroquinolones such as ciprofloxacin. Cipro is something that's given for a lot of different types of infections and is an antibiotic. Frequently, you'll see a little sticker that tells you that this medication can't be taken with dairy or antacids within 2 hours. The reason for this is dairy products contain calcium, and calcium has been found to bind to the antibiotic, making it not work as well. However, more recent studies have found that you're going to have to take a lot of dairy products in order to get enough calcium to cause an issue to decrease the effectiveness of your antibiotic. We're talking not a cup of milk, but like a gallon of milk. So basically, if you can avoid it, that's great. It's not that long of a therapy, usually, 7 to 14 days, depending on what it's used for. But if you have a little dairy in that 2-hour time frame, you're probably fine. Just don't go eat an entire wheel of cheese, please. That would also cause a lot of constipation, and that's a whole nother issue that we don't want to talk about. Myth number 9 is that brand name drugs work better than the generic. I'm not sure who started this, but I want to fire them from their job. Brand name and generic medications have the exact same active ingredients. So if you buy brand name Tylenol, it has the same exact ingredient as generic acetaminophen. They're the same drug. The differences lie in if there's color or dye in them, they might be dyed a different color, or inactive ingredients. Your inactive ingredients are typically fillers and have no effect on how the drug actually works. There are very few instances where I would say somebody needs to be on the brand name versus the generic. For example, certain thyroid medications you have to stay on either the brand or the generic, and they aren't interchangeable because they're slightly different. However, a lot of generic drugs are not like that at all. Some of them are even manufactured on the same manufacturing line as the brand name drug, just under the generic name. And generics are significantly cheaper. Some other times you may consider using the brand name is if you have allergies to the dye that's in the generic or any of the inactive ingredients that are in a generic formulation. And that's basically it. Even if you're used to the brand name drug, switching to the generic should not change its effectiveness whatsoever. Myth number 10 is that medications are quick fixes. This is sometimes true. Medications like Tylenol and Benadryl work pretty quickly, like within 30 minutes to an hour. However, some medications take weeks to months to work well, such as antidepressants or medications for diabetes. It all depends on what we're treating and how the body reacts to it. So some people think taking a pill is going to be a quick fix, and it's not always the case. This is why it's a great opportunity to talk to your doctor or pharmacist when you start new medications to ask them how long it might take to be effective. Bonus myth. This one was also submitted from Instagram, and I think it is a great one to cover. Birth control interacts with antibiotics. This one gets a little tricky and complicated, so it gets its own video, so make sure you hit that subscribe button so you do not miss that video coming later this week. Thank you all for watching, and I will see you next time. Bye!